Our next presentation is Food Pharmacy, a cultural adaptation of the produce prescription program.
My name is Hannah Swartz, and I'm from the Intertribal Council of Michigan. And I have Carlin Artega with me from the Michigan Public Health Institute. And we want to start by giving thanks to our partners, especially our funder, Michigan Health Endowment Fund, for being able to adapt the produce prescription program. So we had the honor of working with Hannahville Indian community, the Little Traverse Bay bands of Odawa Indians, and the Pokagon band of Potawatomi Indians. You can see their locations on the map here, but we had the opportunity to do this food pharmacy project. Produce prescription programs like food pharmacy screen and refer patients into the program who are at risk for chronic disease or have been identified as food insecure. They receive nutrition education and vouchers to purchase and prepare fruits and veggies to reach the goals that you see here on the screen, and then also goals of their own that they set. It really bridges clinical, community health, and community food systems.
We were able to start with a model for a produce prescription program that was developed by the Washtenaw County Health Department, their prescription for health program. But we knew that that evidence base was based on communities really different from ours. So it was a good starting point, but we knew we needed to boil it down to basics and then make changes from there. So we knew that we needed some key people for this type of program. We need a health partner. We need a food source for the participants to go purchase food at. We need our wonderful foods pharmacy staff, and then the evaluation team, which is me. And we also knew there were some other essential ingredients that we wanted to make sure we maintained, even while we were making a lot of adaptations to the original program in order to meet the needs of each community. And so to start with, we created a template that was based on that Washtenaw model. But already right away, we knew all those areas highlighted in yellow would need to be adapted by each tribe. And at this point, we're on like version 6, I want to say, for these maps for each community.
Yeah, so Hannahville Indian community, they changed their map in a number of ways, but most notably, their screening and referral processes differ than the original pathway you saw. They have a 12-week program with $25 weekly vouchers for their farmers market and local meat market. They had challenges with limited staff capacity up in the beginning, and there with data entry, there's quite a bit of it. It took a lot of time, so they ended up kind of pivoting and creating something that worked better for them in later versions of their program. But lessons learned, the first helped with referrals. Community health staff took on much of that work, reviewing patient charts, advertising the program, and looking at patients in overlapping programs, and then bringing eligible patients right to the provider so they could make that referral that much faster. Little Traverse Bay bands opted for a longer program over 18 months with $55 vouchers per month to be used at 6 different vendors. Eligible participants were expanded to include pregnant and breastfeeding women, and patients received a referral after a visit with a provider or community health staff. They also had challenges. They have a large service area. They reach over 27 counties. So that is hard to do with a limited staff in a short growing season as well. But to support their program, LTBB has provided live and recorded video education for both participants as well as their partnering food sources so that they can fully understand the program and the benefits that it has and the goals. They've expanded their vouchers to include more traditional foods like lean meats, proteins, legumes, things like that. And then we have the Pokagon band of Potawatomi Indians, and they have a 5-month program, so they're all a little bit different. And they have $20 vouchers per visit, and they utilize a text messaging system, which has been a strength of theirs. They also have experienced the challenges, and they have been faced with difficulties with participant retention, which I think is, happens with community health programming, and then establishing referral pathways with their clinical team. So they did a lot of work with education and advertising for their program to turn that around. Lessons learned. So instead of enrolling cohorts, they have opted for a rolling enrollment, which has really helped with, busy schedules, things like that. And then they continued outreach with their health clinic staff and community members to bring awareness.
Hannah already mentioned that data entry burden can be a lot with limited staff capacity. We found that using REDCap, which is an online database, really helped minimize the data entry burden and streamline the collection of our universal pre and post survey that all participants at all 3 sites took, and the unique data collection forms that each tribe had based on their different nutrition education that they were able to choose. And through that data collection, we've already seen positive participant feedback, positive participant behavior change, which is increased fruit and vegetable consumption, and a reduction in food insecurity. And we've shared a little bit of our lessons learned today and in our poster, but we are working on assembling everything into our own adaptation and implementation guide that we want to help other tribal communities. We're hoping that that will be ready in January 2024, and we would love to have some of your input while we develop that. And we'd also love to share it directly with you, to email it to you when it's finished. So if you visit this link or QR code, it's REDCap link /food pharmacy guide. You can enter your information and give us a little feedback, and we'll make sure that you receive our implementation guide when it's done. Thank you.